Okay, force breathe. Catches. Okay, good. Good morning, Mariam. My name is Debbie. I'm a student nurse from UWS. I'm going to look after you this shift today. I read your note through, which you might have got a pain. So I'm going to start you a PCA therapy today for you. That will help you for your pain when you need it. Okay. Can you score your pain? 0 is no pain, and 10 is worse than you ever had. Please score your pain for me.
8.
Okay, you might have a lot of pain then.
Yes.
So I'm gonna start you PCA, which is Patient Control Analgesia, so you can control over by yourself. So I will tell about you more in detail after. I'm gonna check your ID, so make sure you're the right person. So could you tell me your full name?
Adib Miriam.
Adib Miriam. And your date of birth is?
7/01/1969.
Okay, 7th of 1st, 1969. You're 7th of 1st, 1969. And your MRN is 174963. 174963. Do you have any allergies?
No, I don't.
You don't have. Do you have allergic? Are you allergic to morphine?
No, I'm not.
Okay, that's good. So you can have that. Before I do, I'd just like to quickly check your IDs, the site for the PCA. It looks fine for me. Do you remember when that has been put on?
This morning.
This morning. So it doesn't look any redness, anything. So it's good to go, I think. I'll be checking again anyway. So I'm back now. I will be my second RN, so we're gonna validate the order.
Yep.
So here, I've got right base in Mariam Adbib. Her date of birth is 7th of 1st, 1969. Her MRN 174963, and her history is she's post-operatively ribs fractures, so doesn't have any allergies. I checked with her, and all details are correct. The doctor has prescribed her morphine 50 milligram for 50 ml, which is I have to make the solution 50 ml, and doctor has signed, name is written there, date is correct. So concentration for the PCA is given here, all of the details. So concentration 1 milligram per ml, number of maximum series is 3, PCA dose 1 milligram, lockout interval is 5, so she can have within that 5 minutes. So basal infusion 0, that means she doesn't have any other fluid going at the moment. And hourly dose limit is 12 milligram, and doctors has signed there. And this is intravenous analgesia, morphine that goes through intravenously, which is right route. And this medicine has been given it, so it hasn't been signed. Time is not given it. Not been given. And doctor has prescribed antiemetic, which is metoclopramide. Dose is 10 milligram IV. Maximum dose 3 times a day. Date is written, which is correct. And Naxolone also given just in case if he gets overdosed to reverse that effect of narcotics. He's having naloxone. This 0.2 milligram IV and can have 2 to 3 minutes interval time. And date is given, so which is correct. Are you happy with this?
Yes.
Okay. What I do now, I go and collect the equipment. I've got that's ready, so just there. So just get this one. Okay, I got equipments all there to go, and I need to go and do my acid drug first. I'll go to the acid drug. Will you be my second item? So yes. I need to check the acid drug. Might get this with us. Alright, this is book. So first of all, she's having morphine. You get morphine chart. That's it. Morphine. Let's check morphine in the front. Page number written, page number morphine 23, morphine 23, page 23, 23, it's not given. This is that one. 15, morphine 23, fine. This is one. This is morphine. Yeah, okay. This is morphine sulfate. She's having 10 milligram. We got this stock as 10 milligram per 2 mil. So I'm gonna open this and check how much morphine we got. Okay. I'm just checking that balance is 5 there. 1, 2, 3, 4, 5. We got 5 balance. So I'm just gonna check this morphine is not expired, and so 10 milligram 2 mil. So according to this, to make that 50 milligram, it's so easy to calculate. We just need 5 of the ampule. We might need all, and they're gonna be 0 in balance. So making that altogether 10 mils, that's the required volume of morphine. And it's not gonna be left, but just gonna write down. Okay, so I'm gonna write down this today's date, 3rd of 3/17. Time.
It's 5 to 10.
5 to 10 means 9:55. The person's having morphine is Maria Mariam Adib. She's having 50 milligram dose. That's amount given. We don't have to discard anything, so not worry. We're gonna use 5, so this is gonna be 0. And doctor's prescriber L-Hand, Linihan, and name of the person administering, that's me. The Podel signature. Would you the second one? Just gonna sign there for me. Okay, good. So I'm checking that. There's 0. So according to drug book, there is none. You can go off. There, I'm just gonna put that back and lock the cupboard. Okay. For this purpose, I'm gonna leave the key here. But in real life, we have that key with us. So what's my name? I'm just gonna read morphine, which is doctors has prescribed 50 milligram, which is the right dose or not. Just taking the morphine, and what is that for? Morphine is it is a narcotic agnostic. Has used for more severe type of pain, because this person has refracts. She might have a lot of pain, so she's having this. Contraindication is acute severe bronchial asthma, obstructive airway disease, respiratory insufficiency, depression, or sinuses. So she doesn't have any of those, so she can have it. And adverse reaction would be respiratory depression, apnea, circulatory depression, include cardiac arrest, impaired alertness, sedation, dependence, tolerance. The opposite. If she has one of those reactions, we will be stopping that. So at the moment, the dose is we're using at PCA. In PCA's demand dose is 0.5 to 1.5 milligram in adults. His adults is having 1 milligram according to doctor's prescription, which is correct. So this medication I checked with the drug book. So it is compatible with morphine, I'm saying. This is a narcotic opioid analgesic. Compatibility is glucose 5% or 10%, sodium chloride. So I'm taking sodium chloride as a diluent to make that 50 ml, making doctor's order. Okay, now I'm just gonna quickly do my first drug check. So I have got those sodium as well. Okay, let's pick that up. Good, thanks. Okay, I've got right patient Edith Mariam. Her date of birth is 7th of 1st, 1969, and her MRN 174,963. Doesn't have any allergies. She's not allergic to morphine as well. Doctor has charted morphine 50 milligram for 50 ml. Doctor's signature there. She's having this concentration 1. PCA concentration is 1 milligram per ml. Number of syringes maximum 3. PCA dose is 1 milligram. Lockout time interval 5 minutes. She doesn't have any vessels infusion, and hourly rate 12 milligram maximum. Doctor's signature not given. It is intravenous. Just in case. Doctor had charted had anti-emetic and naloxone for reversing. Anti-emetic for if she feels any nausea, and naloxone for if she feels drowsy or might need to reverse that effect of morphine. So she's having that. And with this first drug take, so she's having morphine sulfate injection 10 milligram 2 ml. So a drug calculation so easy. So I can say that she's having 10 mg, that makes 50 with 5, so it doesn't need to calculate for me at the moment, so I'm quite correct. And she's having 10 ml of morphine, which is 2 mils, 2 mils, 2 mils, 2 mils, that 5 mils equal to 2 mils equal to 5, that makes 10 mils. That's volume of morphine that required, and which is not expired. Medication not expired, which is 10, 20, 10, 20, 10, 20, 10, 20, 10, 20. And this is sodium chloride, which is going to dilute it with this morphine to make 50 ml altogether. Sodium chloride, all of the sodium chloride, and this medicine not expired, with all of them expiring October 17, October 17, October 17, October 17, October 17. Yes. So are you happy with this first drug check?
Yeah.
Okay, that's good. Just wash my hand quickly. I'm just going to draw. The medication. Just make sure like that. Now I'm just going to get them 7, 2, 5 of them. Okay, open this. It's too hard at the moment. Just gonna draw morphine first. It's gonna take me time. Left-handed. That's good. Mm. Okay. Okay, I'm just gonna make sure it's 10 mil. If it's more, I'm just a little bit more. I don't know, just discarding that. Yeah. You happy with this 10 mil?
Yes.
Okay, 10 mil. Now, a little bit, maybe more. That's good. Now I'm gonna draw this to make 50. Body, just gonna make that to 50. It's gonna be hard. Okay, so you can check. This is just 50.
Yes.
There is a little bubble, but it's fine. Just 50.
Yeah,
Yep, happy?
that's right. Yeah, I'm happy.
Yeah, 50. Good. Now I'm just gonna just take this out. Just put in this out straight away. Again, now. I didn't open that before. Hopefully. Okay. Connecting that to this. So I'm maintaining the septic technique. So this is just rubbish on. I can press in there just in case. So making sure it's not tangled. Yes, taking time. okay now. I'm gonna do this fill up first. I've just done one drug check. So patient is Miriam. Miriam ADIB. ID is 174963. Date of birth is 7th of 1st 1969. Medicine is morphine sulfate. So just write that shortcut. Amount 50 milligram in 50 ml. That makes 1 mg in 1 ml. So it's a bit wet. If I get in real situation, I use the other one. Diluent is normal saline 0.9%. LINE Celium, and date today is 3rd of 3rd 2017. Time, can check the time, 10 past 10. 10 past 10, prepared Devi. Can you check some next one?
Morphine sulfate 50 mg, 1 ml. Yeah, that's right.
Before I do this, put this sticker on. So, I'm going to do that there. Okay, this is Adbiv, all details correct. Cool. So now I do my second drug check. I got right patient ADIB, Mariam. Date of birth for 7th of 1st 1969. MRN 1744963. Doesn't have any allergies. Doctor has prescribed her morphine 50 milligram. Morphine 50 milligram. I draw up and I show you that altogether 10 mil.
Yeah.
And I draw off 40 mils to make that 50 mil constitute.
Yeah.
So altogether 50 mil now. I just showed you before. So using this sodium chloride as a diluent, and this I use them.
Yeah.
Sodium chloride, all of them sodium chloride, not expired October 17, all of them October 17.
Yes.
As well as the right drug morphine, which I've done. Draw up there. 5 of them making that 50 milligram, each having 10 milligram. And this medication not expired is 10/20, means 2020 and 10th of month. So all of them having same, and all of the medication morphine sulfate and not expired, all of them. They have all concentration 10 milligram 2 in 2 mil, that makes 10 mils and 50 milligram altogether. So that's second drug check, and this is intravenous medication not given, and just in case for the nursing consideration, the doctor has prescribed 2 medication, naloxone and an antiemetic drug, metoclopramide, which is Maxilon, just in case. So this is my second drug check. Now I'm gonna go and check my second patient. After second patient check, hi Mariam, I'm back with your medication, which is almost ready to go. Could you please? I need to check your ID band again. Could you please tell me your full name?
Adib Miriam.
Adib Miriam, and your date of birth?
7th of 1st 1969.
7th of 1969, 7th of March 69, and your MRN is 174,963. 174,963. Thanks for being my second RN. And do you have any allergies?
No, I don't.
Okay. No. Are you having any allergy to morphine?
No.
You don't. That's good. So you're going to have this PCA, patient analgesic, for your pain control. I'll be telling you that after anyway. So, okay. So, this one, and then Yeah, I'm gonna check the side. The side just looks alright, which is good. Do you remember when this has been put on?
This morning.
This morning, and it doesn't look red, doesn't look any swollen, so it's good to go. And obviously, before I initiate this analgesic morphine like opiates, I'll be taking vital signs for the residents, and I'll be recording at the end here in this PCA chart. Okay, so I'm gonna do my third blood check right now. I've got right patient here is Edby Marion, date of birth 7th of 1st 69, and MR 174,963, doesn't have any allergies. Doctor's prescribed morphine 50 milligram, 50 ml, and before that I forgot to tell all of them, but these details are correct. So PCA for morphine, concentration 1 milligram, number of syringes 3, PCA dose 1 milligram, lockout interval 5 minutes, and hourly limit is 12 milligram. Doctor signed this, prescribed this, not given it time, and this is IV medications, and as well as this medication morphine that makes altogether 50 milligram, which is not expired. All them in right. I've been checking expiry and concentration 10 milligram 2 mil, 10 milligram 2 mil, 10 milligram not expired, 1020, 1020, all of them same. And as well as this sodium chloride, which I did make 50 ml concentration, including this 40 ml of sodium chloride. So these are all correct at the moment.
Yes.
So what I do now, yeah, I'm gonna put this on to the patient. This is ready there. I think I've forgotten to prime. I just do prime this before I do that. Just up there.
Little bit more.
Just there. Okay, that's ready.
Yes.
It's been primed. Okay, this is the rising tap. This is on. So to go. Where's the key? Oh, here you go. Just put it there. Turn it on. New person information, yes. One, yes. Confirm new person, yes. Morphine is ours, so 1 milligram per minute, but it has maximum dose, so we go according to the chart. I'm checking this chart there. So 1 milligram, 1 dose milligram, 5 minutes is interval. Well, 5 minutes interval is correct, but maximum dose is 12, which have to check it. Change it, modify protocol, go down. That's the one, alter. Go down. Okay, then confirm. And this is 12 mg, which is ready. So that's okay. So you can see morphine 1 milligram per ml, 1 milligram per ml, 5 minutes lockout, 12 milligram 1 hour. That's all according to this, and turn this on. Now I'm just gonna connect this to the patient, so I need to wash my hand and get the gloves. Hi Miriam, I'm back with your PCA, which is almost ready to go. it's ready to go. It's ready to go. I need this to just in case make sure. This is to connect. Okay, so before I start this, I need to do check the side which is doesn't look swollen and it's all right, because I've asked you already about that. So at the moment, just gonna just move that apart, and I need to flush it. So I'm going. Does it hurt when I flush it? Before I flush, what I do actually, I'm just gonna clean it. Make sure it's clean. Good. So this is rubbish. Now, I'm just flushing you. Are you having a pain?
No.
The second arrow?
Yeah,
No.
no.
Open. Okay, that's ready to go. Just gonna connect it. And just turn around. Got there. Yes, thank you. Being good friend. Okay, so tightly secure. That's there. Okay, I'm just gonna do that. And place my hand. Okay, Mariam. It's gonna start this. And where's that budget in PCA? Just gonna. Okay, confirm series. Just getting ready this. Hi Miriam, this is Patient Control Analgesia, so it's called PCA, which is a machine that delivers 1 milligram of morphine each time when you press. But you have to wait for 5 minutes. That's why we set up for that. You won't get if you press again and again. But when you feel pain, you are controlled by yourself. You can press for the pain. But what it does actually, if it goes all green, fully green, you can press it. And when it just like slightly giving little greening, that means it's delivering the medicine in your system. And when you get dim and go back to again green, that means within that 5 minute time, you can push the button and get another dose. And I'm just gonna give it to you, and you can try now. The first dose start. I start to begin outside. Or maybe you can start to begin PCA available. So when you pressed, you can see the green and it start. Do you want to press it if you have pain? Yep, okay. That's starting now. You get one dose now.
10:28. It's already comes past. So,
okay, I'm just gonna, I'll be back and take you there. I'm just gonna sign this one with date is 3/3/17, time of 10:30, and initials DP. We just wanna sign that.
Yes, thank you.
Thank you, Mariam. I'll be back in 15 minutes. Check you for your, and this is the end of the test. For the vital signs, I'll be writing the vital signs for the patient anyway here. Thank you.